things that they're finding in the amyloid of people who demonstrate dementia is porphyromonas gingivalis. How did it get from here, cross the blood-brain barrier, and get in? Uber? How did it get there?
Conspiracy theories.
Right, okay. Because of the sheer demand that's coming in through the door, right? I tried retirement. That sucks. Right? No, that sucks. Trust me.
I personally would say we overlook it.
Yeah.
I mean, med school, training, when have we ever been told anything about the mouth? Have you ever looked in your 8 sessions a week in someone's mouth before you came to 21D? Generally.
Rarely, but yeah.
But you're staring at them more now, right?
Yeah. No, exactly.
You're looking at them more now, right? You're going, that doesn't look right.
Yeah.
So, for everybody that doesn't know, you should know Harry. He's all over the route.
I've been recognised in the street already. It's just like a very strange experience.
Well, it's a community, you know, and I wanted this community. I've been doing this for such a long time, and I know that that's what's lacking.
Yeah.
People suffer in silence, and you must have had moments like this yourself.
Oh, years.
Yeah.
Suffering in silence.
Where you thought, you know, oh God, what have I done? Why have I allowed myself to get this far? A bit of self-loathing going on, you know, and a bit of, oh, why me? All that kind of stuff. And there's just no resource.
Yeah.
There's just no place to talk about this or just get information about this to go, oh, okay, it's a degenerative condition. It's going to affect 1 in 10 of the human race at some point. Okay, I can't go around just vilifying myself. Okay, I was a bit wild in my 20s, but who wasn't? Yeah, but who wasn't?
Yeah.
This is life. Now, if we all had the decency to be dead by the time we were 50 like we did 200 years ago, we wouldn't be having this conversation, would we? But we do live in a world where human longevity is the greatest it's ever been. And as medical professionals, we are seeing things that we've just never seen before. Why isn't this considered as one of those things?
Yeah, I think it's overlooked in this country. And I think personally for me, quite a few traumatic experiences with dentists as a child, and it does massively affect people, as you can see from the Facebook group when people are sharing their stories. But there is that sense of shame when it gets to a certain point. Did my research and came across 21D. So
the question I have there is, even as a medical professional, did you still have that aversion to dentists?
Yes.
From a child?
Yes.
Yeah, but
absolutely.
does that ever go away if you have a degree? So if you've been traumatized when you're young, or you go through a trauma, where does your rational degree come in and go, okay, well, I can analyze this trauma now?
Well, it never does, but I just wondered whether it would change in
I
any
think
way.
That fear has been there from, a very young age, and then in and out of hospital with the Crohn's disease as well. All the medications that they've tried over the years, and obviously all the while this is getting worse and worse and worse, to the point where I think I've mentioned in previous videos that I was quite ashamed of speaking to patients, just kind of doing anything I could to kind of cover my mouth.
When you were doing that, were you ever not conscious of it?
It was omnipresent.
All the time?
All the time. I was even having nightmares where I'd wake up and I'd constantly check, have I lost a tooth? And probably at least 2 or 3 times a week that was happening.
What's upsetting to me is I've heard this non-stop for 26 years. It's always the same. And I think, I'll tell you what I find particularly infuriating, right? So I'm a medical professional. I've spent 26 years explaining to people why I do this for a living, and I don't actually have the option to stop because of the sheer demand that's coming in through the door, right? I tried retirement. That sucks, right? No, that sucks. Trust me, I tried it, and it lasted about 8 months, right? And I just went, what am I doing, right? And then it's the constant, and I keep looking at the data. So the Adult Dental Health Survey comes out, and the number of people with less than 20 functional stable units has actually gone up in the last 10 years? And everybody's giving me this bullshit that apparently we're doing such a good job of taking care of the nation's health. And I'm like, well, why is it going up then?
Yeah.
Surely it should be doing this. And then I'm seeing people being told stuff that it's just bullshit. Okay, oh yeah, just go and buy some screws and stick them in, and there's magic. Like,
wow,
what? But in the medical profession, here's what's really weird, right? In a hip replacement scenario, you need a new hip, mate, and everybody just goes, oh, okay, and then they go and get a new hip, right? And at no point do they sit there and go, can I have a blue hip rather than a green one?
I can imagine that's quite frustrating, actually, seeing that.
So, okay. Yeah. Everything is a clinical parameter. Anything we do is a clinical parameter, and it's calculations. There's no opinions here. It's just pure scientific fact. So for you, the smile on your face, there is a shape to your face which has a dimension, which means there has to be a shape that matches that shape. Otherwise, you know those people you stare at in the pub with those massive square blocks in their face? That happens. Yeah. People start talking to your teeth. Yeah. You don't want anyone talking to your teeth.
No.
Size. That is a finite size. I can't work outside the size, right? You've got cheeks, you've got a tongue, there's this area in between, and it's not a big area, and I need to stay in that area. Otherwise, you're going to bite your tongue and you bite your cheek permanently. So there's all of these things that have to be calculated. But if patients are assaulted online with things like, oh yeah, come here and for $3,000 it'll be like this. A, the price has nothing to do with it. Okay. And B, that's bullshit.
Yeah.
And it's that's the problem.
Yeah, I think most people that are researching this do look at Turkey, sort of other countries for an option because it's a lot cheaper. And I'd be lying if I said I didn't consider that myself. But it was the fear of complications. And then it's not just down the road, which literally is for me here, but it's a long way to go if you've got something that's gone wrong.
You know this as a medical professional. Is there any such thing as treatment without an aftercare pathway? Right, okay. So we're all agreed on that one then. So there is no such thing as treatment. It's treatment and aftercare. And in your experience as a medical professional, both of you, how important is the aftercare?
More important.
More important. Yeah. Okay. So then I think to myself, okay, how did we as a profession, and I'm not going to discriminate between my Turkish colleagues or my American colleagues or what, how did we as a profession manage to get into a patient's head that you can just go shopping and have a new body part? If we're going to transition to the third stage, so you've had your baby teeth, you've had your adult teeth, biology has given up, we are now moving to a third state. It is a managed prosthetic state. No, we're not growing new teeth. Only Jesus and nature can do that, right? Third prosthetic state, do you understand adaptation? I mean, if you have a hip replacement, if you have any kind of orthopedic rehab, there is an entire phase of adaptation.
Well,
I'm not running as quick as I could when I was 21. Why is my hip not letting me, climb up the walls? That's not what it's for.
Unrealistic expectation, isn't it?
And it's that realistic expectation side. And also from your general health, how much of a difference has it made?
Massive. Absolutely massive.
Talk to me about that.
So as you know, I've got Crohn's. I'm on infliximab injections every 2 weeks. But I was saying to you before you arrived, Vijay, that just being able to chew your food properly, that's kind of a major difference. It probably seems something most people take for granted if they've got healthy teeth. But when you've got broken teeth and you're not able to chew things to the standard that you should be before swallowing, then that obviously is going to have an impact on the gut because the digestive system is going to have to work a lot harder for that. So definitely noticed an improvement since having the LTPs, being able to chew properly from that point of view.
Do you know what I've noticed more and more and more in my career, 32 years? the number of people on omeprazole,
Yeah.
it's frightening.
100%. It's given out like candy these days.
Exactly,
I'm sure you do it in your day job
Absolutely.
as well as me. Can I just take things back a little bit
Yeah.
to what you were saying about your teeth and being unable to chew? So how did that make you feel let's go from a mental health perspective first. How were you? Where were you?
Yeah, so went from somebody that enjoyed going out for food and having meals to probably the 12 months prior to having the operation, just wouldn't consider it.
So you self-limited your own life because of what was going on here?
Yeah, even as a medical professional, just, couldn't rationalise that. But yeah, so stopped really, special occasions we went out, like somebody's birthday, but we used to probably go out every couple of weeks at least for food, because it's a nice sociable thing to do, but yeah, just felt too embarrassed.
Let's talk about menu scanning, because I know that's the other thing you lot do, right? Let's talk about menu scanning.
So one of my favourite things to eat is steak. And that was the first meal that I had after having my LTPs put in, and it was the best steak of my life. But probably for a good 2 years beforehand, it wouldn't be something that I would order, especially going out. At home, different sort of mentality, but yeah, definitely if I went to a restaurant, it would not be something that I would even entertain looking at.
And then with regards to, so you mentioned you had Crohn's. Mm-hmm. How's that changed from before you had your prosthetics to now?
So I think, just obviously chewing better, sort of digesting things better. I mean, I kind of wondered whether, because I do get dyspeptic symptoms from time to time, and wondered, is that the Crohn's grumbling a little bit? Or I think now it was probably me not being able to chew properly.
In your own mind, as doctors, I'm asking you both a question. How much do you think we spend on the NHS in 10-year management of Crohn's people if they've got that going on in their mouth? How much money do you think we're actually spending, if you were to tot it up?
Tens of millions, probably.
Right. Okay, so on a per patient basis, 10 grand?
Per patient, yeah, easily.
Easily 10 grand.
I think when the biologics first came out, they were very, very expensive.
Yeah. A lot of them still are, and the new ones still are. So 10 to 100 easily per patient.
We've got pills that are sort of subduing the symptoms, and then we've got a solution over here. That's a one-time investment. Why are we choosing this one and not this one?
Preventative, yeah.
I mean, I've had Nitesh do some work, and I think it's more to shock the shit out of him.
Yeah.
Right? So he's been staring at papers that are connecting stage 3 and stage 4 periodontal disease with systemic diseases. And, he's only like 2 doors away from me, and he keeps coming in going, have you seen this? I'm like, yeah. I've seen it. Now you have as well. Yeah. You have as well now.
Exactly. And it is absolutely crazy. Just the links to virtually every part of the body. And it's something that I've mentioned before, but also just realizing that, your mouth, your gums, it is still the same part of your body. You wave goodbye to your dental colleagues in your second year of medical school. Yeah. And at that point, you don't learn anything more, again, about the links between your mouth and the rest of your body. And the more reading I do, the less ignorant I become, I think, is probably the best way to put it. Suddenly you realise, well, it's linked to a whole bunch of scary stuff. And there's been papers on it for years. But no one's really shouting about it. No one's really talking about it. And I think it's something that we really need to put some emphasis on, whether it be your gut, whether it be diabetes, cancer. It's even linked to aging, Alzheimer's, heart attacks, strokes. The papers they almost fell into my lap once I started looking. Yeah. And it became ridiculous.
I think it's one of those things, particularly being GPs, that the dental issues are kind of filtered away from you before they even get to you, because it's not a part of the body that we deal with. Generally,
it's kind of part of the body.
Exactly, that's the thing. So I think that's why we probably don't get as much exposure to it and make the links that we probably should be making.
So he was the one, he came and said something interesting to me, apparently, that in the 60s, all GPs would get a report from the dentist.
Oh, right.
About the status of oral. I just want to know who stopped that.
It's a good point, because we still get things from ophthalmology.
Yeah, we get
annually.
People go to Specsavers. I get a letter.
Exactly.
Right, okay.
So why don't we? Yeah, good point.
Right. So, who decided to stop? Who just went, okay, yeah, you know what? That's
Not
just
important.
not okay.
Yeah.
But we had it in this country in the 60s. We had it. It was
Yeah.
there. This communication line just doesn't exist anymore. And we are probably the most invasive primary care that there is between GPs and general dentists. We probably, the ophthalmologists, okay, you know. All right, I'm not, but they'll get annoyed if I say things, right? But you know what I mean? It's glasses, fellas. Come on.
Yeah.
Put it into context here. But you don't get a report from a guy who's staring into the body, beginning of the digestive tract, with the most dangerous bugs we have in our entire body. That's where they all live.
Yeah.
The other thing I read, and I've read 3 papers on this now in the last 4 weeks. So one of the things that they're finding in the amyloid of people who demonstrate dementia is porphyromonas gingivalis. How did it get from here, cross the blood-brain barrier, and get in? Uber? How did it get there?
Conspiracy theories.
Right, yeah. I'm reading this and I'm going, okay, so that's in black and white. The data sets are huge. We're not connecting currently 60 million documented people globally with this, right? Now, what is that causation and correlation? That's the gray area. Well, we don't know how the bugs from here got there, but we do know that the bugs from here got there.
Mm-hmm.
Is there a connection? Well, they are finding it in the amyloid that's causing the problem.
Yeah, so it sounds quite likely, doesn't it? Yeah.
You know, and 1.2 trillion. I mean, that's a third of Britain's entire GDP per year. That's what we're spending on 60 million people. What happens if it goes from 60 million people to 600 million people? Because it will.
Yeah.
We know that. Who's going to pay for this? Be under no illusion. I'm not some Mother Teresa type, right? I'm an economist and a taxpayer. Okay? I want the tax money spent well.
Wisely, yeah.
Okay? Where it's most effective. So if I can give them pills forever, which suits the pharmaceutical companies, of course, or I can fix them here in a rehabilitative state and manage them long term, I know which one's better value.
I think generally in any preventative medicine side of things, I don't think enough is done, or we do a lot of what we do is we do it when it's too late. We wait until it's too late and then it's done. And that's the way for a lot of things these days, that's the way things have been turning out. And it's almost like we need to take a step back and just have a look and work out, well, what can we do preventatively?
I'm a bit more objective about what it means going forward. I mean, diabetes is the classical one, isn't it? That someone's heading towards pre-diabetes is always pre-diabetic. We probably should be doing more at that stage, but we're not. And I think, unfortunately, the NHS is in a situation where we're firefighting, aren't we, essentially, at the moment, on every front.
We're going to drown. It's just a fact. How much has your optics on your own lifestyle changed? What has it done for you, this?
It's changed it quite a lot, actually. I think more from a mental perspective than anything. I mean, physically, I was sort of exercising probably too much, if anything. I was trying to eat as healthily as possible, but with the issue with chewing, probably eating a bit more processed food than I probably should have been. Now I'm making healthier choices with food.
So you recognise that you were eating more processed?
Yeah,
garbage.
absolutely, yeah.
Right, okay.
What
And that's
sort
you
of-
as a GP?
I know.
Right, okay.
and
No,
what did-
there's no judgment here.
No.
We understand.
And what sort of processed foods were you eating?
So with sort of, obviously the hours that we work sometimes as GPs, a lot of it is just convenience foods. So sort of your sandwiches from well-known sort of chains of supermarkets, things like fast food as and when if you had a really
Softer
long
the
day.
better, right?
Yeah, so
And that's where I was getting at with
chicken
that.
nuggets, things like
Soft,
that. Yeah.
Whatever you didn't really need to chew. And then how did that make you feel once you'd eaten it? How did you feel?
It satisfies the hunger, but then there's always that guilt of I've just eaten something that's probably not 100% good for me.
But then did you also have that lull that after you'd eaten, you suddenly felt really tired and
yes, oh, absolutely,
drained, and almost worse 2 hours later?
I think, I mean, with managing my Crohn's in the past, I have had to go to an elemental diet when I was on very high doses of steroids, just because it was probably more useful in some ways than actually taking the prednisolone. So being on the liquid diet or the soft diet, from having the deprogrammers to the LTP, I noticed quite a big change in my energy levels in a positive way, which it's like, oh, lots of sort of protein shakes, which again are processed, but just making better choices because obviously the options were limited. Yeah, I had to think more about what I was putting in my mouth. So yeah.
We as humans cannot sit by and make excuses as to why these other humans are suffering and not look for a solution for them. What we have to do is have a whole new way, a far more joined up way of looking at a person's health. And we talk about them all like they're separate. So there's mental health, there's physical health, there's emotional health, they're all joined up because it's one entity.
Yeah.
And if we're not tracking all of it at the same time, making sure, so the physical health can be great, but if the mental health is over there somewhere, it's only a matter of time before this thing falls off the cliff.
Yeah.
We all know this. We also need to change, in my view, the dynamic of we need our friends in pharmaceuticals, but do we need them anywhere near as much as we're using them right now?
No.
But come on.
Yeah. A lot of money to be made though, isn't there? So that's, yeah.
Yeah, okay. Again, there's a lot of money, but equally, is it as effective?
No, definitely not.
I've never viewed healthcare as a cost. I've only ever viewed it as an investment. And if you change the narrative from saying that healthcare is expensive, it isn't. Healthcare done right is the best value commodity on the planet by a country mile.
I mean, what do you have if you don't have your health?
You have all the money in the world, and if you haven't got your health, then it's worth.
You're investing in yourself to have the best quality of life for as long as possible. And whether that be kind of having new teeth or people having new hips or anything, when people are investing in their own ability to be able to chew, with their prosthetics, it calms their gut. They can move more. They don't need to constantly look for a toilet or anything. It's similar all the way through. You're investing in your ability to have the best quality of life for as long as possible.
And that's the way that I viewed it was, and it's probably the only time that I've ever invested in myself. Yes, it was not an easy cost for me to find, but it was definitely something I thought and it has been life-changing.
I'm so glad you brought that up. It's because I want to talk about that from your point of view. You invested in you. Good decision.
Best one of my life.
Best one of your life.
Easily best one of my life.
Easily the best of your life. That level of quantification of well-delivered healthcare is exactly the thing I'm talking about. One of the things I do, so I've got this 5-word mantra. So I've got what my missus calls the crazy room. Both my ex-wives called it the crazy room, right?
Okay.
And the crazy room is where I go, right? And I just write my thoughts down. So I have 5 words written down: simpler, safer, faster, cheaper, better. Anything I create must tick all 5, or it will never leave that room. Now I've got boxes and boxes and boxes and boxes of stuff that will tick 3 or 4.
Mm-hmm.
And very few that tick 5. But the ones that tick 5, you have one of those in your mouth right now. Right? But the simplicity thing is important. It's got to be simple to deliver, and it's got to be simple for the patient to receive. The safety thing is non-negotiable. I'm just not playing dice with that one. Faster. You ask any surgeon in the world how long he wants to be, how quickly he wants to be in and out. The answer is always the same, the quickest possible.
Yeah.
It's not even a debate. You know this. Post-operative healing is better if I haven't cut you open for 10 hours and it's only an hour. Cheaper. I mean, I live on planet Earth, right? I don't care if you're Elon Musk. Everybody looks for good value, quantifiable value. And it's not the market setting the price. What innovation does is it changes the dynamics, the optics of what value looks like. So there was a time in the world where there was the thing called the Nokia 3310.
Remember it well.
Remember it well. And then one day, this phone with one button appeared called an iPhone. It was more expensive, but the value in it was better than the 3310. And all of a sudden, people forgot about how much it cost and went, this is better for my life. And it made them more productive. In medicine, I don't see any difference.
And as much as it's not a small amount of money, when I was doing my research, I think I had in my head a price that was several times higher than what you guys were charging. So,
like America, Brittany.
Yeah, I think that is what was ingrained, and that's what I kind of expected. Hence why, obviously, a lot of people that can't afford that price go abroad. But equally, like you said, you need to think about why would you spend £5,000 on something that's going to last for 5 years, or £10,000 on something that will last you the rest of your life. It's a no-brainer, really.
I've had clinicians here say to me, "Oh, but they're all going to go to Turkey." Well, you're charging 50 grand, mate.
Yeah. So,
and you are surprised. Tell me your justification for charging 50. You're very specific to tell me about these people in Turkey who are charging 5. Explain your 50 to me.
Yeah.
Because it's grossly off the mark. Oh, well, I've been doing it a long time. All you're telling me is you've got cataracts and half your brain's dead. You understand? That's all you're telling me. I'm not hearing anything else.
Yeah.
And we have a duty to not sell anything. They either need it or they don't need it. It's binary.
Yeah. I think that's the thing that was very evident when I was doing my research in that, and it's obviously quite prominent in the group at the moment, people moaning because, well, not moaning, or putting their thoughts forward about the fact, oh, I've not been accepted for it. Well, it's because you've got too many healthy teeth. That this is a good thing.
Oh, but I want a quick fix. Well, okay, if you had a headache, cut your head off. That's a quick fix.
Exactly, yeah.
But no one's doing that. Yeah, we're not going to do it. We have a duty. And we're not going to change that. We're not going to compromise that. I've not been accepted. Accepted for what? Disability rehabilitation. Maybe it's because you're not disabled, mate. Maybe it's just in your head. I've never not accepted someone and not told them a much better alternative. So they conveniently leave that bit out. But it's always, oh, I'm offended now. He rejected me. We're not having a date. Do you know what I mean? I'm doing my job. You understand? We're not on a date. I'm not saying, okay, well, I don't want to see you again. That's not what's going on here. I'm just going, you don't need this
yet.
And you should be bloody grateful.
It's a good thing.
Exactly.
That you don't need us yet.
I think that's what some of the more prominent members in the group are so good at articulating to them. It's like, well, this is a good thing that you have got healthy teeth that are going to last you for several years to come. So you don't need this procedure at this moment in time. But I think people just want, or some people have that mentality, they just want that quick fix, like with a lot of things in life.
I can't think of better people to talk about this than people who've actually been through it. I can go all technical, but I've never had it done. I've done it to loads of people, but I've never actually been on the receiving end of it. Claudia has a perspective, and Gordon has a perspective that is like, they are clearly articulating from known experience.
Yes.
You can just see it in their eyes, you can hear it in their voice, and it's the words they use, and it's just perfectly descriptive. So the first thing that we're going to do, I've got a meeting with about 20 from the patient group on Zoom on Monday. Because I'm getting inundated with letters like this. Going, I'll do it, Vij. I'll do it. I'm so happy about this.
It was testament to the company, isn't it? And like I said in my LTP video, anything I can do to champion 21D, because you have literally changed my life, I will do so.
The most important change I want to do, with the help of the patients, is I want everyone in this country who is suffering with this to know that they're not alone, to know that there is a fix, to know that it's really straightforward, and to know that they don't have to die that way. I'll never stop building clinics so long as the phones go off the hook. I'll never stop. I've got nothing else to do with my life. Honestly, I'm a very dull individual. Right? And I just need it. I need to live in a Britain where if it's as normal as shit to go and get a hip replacement done, it's as normal as shit to go and get an oral rehab done. I need to live in that country. And I need all the help I can get. I really like the idea of patients having a direct input into patient journey.
That has a massive impact on it. Yeah.
Okay. You have any? So there's two parts of the journey. There's the scientific logistical part, which, let me be blunt, no one gives a shit about. And then there's the emotional part, which is I just need to speak to Claudia so she can say something to me that will just calm me down. It could be anything.
I've been in that position.
Right.
So,
you know
exactly,
that.
Yeah.
And the difference that makes is like night and day. I wouldn't give you a treatment plan if I didn't know you need it. Which means if you've got a treatment plan in your hand, and be honest with me, Harry, how many times did you try and talk yourself out of it?
A few.
Right.
Yeah. And even like after I'd booked the surgery date, it was December when I had my first initial assessment, and then it was early February when I had the operation done. And it's the fear of the unknown. But the Facebook group, which I only found a few weeks before the actual operation, sort of hearing everyone's testimonials and just how everyone championed each other in that group, it was just, I've definitely made the right decision here. And
this is
I'd
you
just
as
go
a
back
medical
to that
professional, as a GP, but being human. So you've got the GP mind, you know about hip replacements, you know about rehabilitation, But even you, as the patient, is going, I'm shitting myself.
What am I doing? Yeah.
What am I doing? I need to talk myself out of this. Any old excuse, blah, blah, blah. So I had one a few weeks ago. This was hilarious, right? So I was told about this patient who was clearly just shitting themselves, right? And they'd booked the surgery, came up with some horseshit excuse, cancelled it.
Oh, right.
Right? I knew that he was just crapping himself. Nothing else, right? And then we did the whole, okay, let Claudia out.
Release Claudia.
Unleash Claudia, right? He was still spooked. And Claudia was like, Vijay, he really needs us. You know, he's just really scared. I never do this. So I phoned him. I said, listen, mush.
Oi.
Oi. Right. You and I both know that your life sucks. I've got your interview video, and you and I both know that you've been living with this for way too long. And you and I both know that you're desperate to get to the other side. Why don't you tell me, honestly, right now, what is the thing that's putting the fear of God in you? And I'll try and help you get over it. And he said, you know what? I just had a terrible experience when I was a kid about having teeth out. First thing is we're going to give you a local anesthetic. Do not underestimate its power. Okay, just don't. Trust me, I've been doing this a long time. Don't underestimate it. Second thing, you've got 8 teeth left. 8. Context, okay, 8.
Yeah.
And they're waving about in the breeze. Third thing, I'll make you a deal. From me to you. If you feel even one, I'll give you your money back. Do it for free. Just don't lie to me. If you didn't feel it, don't say you felt it. You shit. You know what I'm saying? And he just went quiet and he went, why are you doing this for me? I said, because you need it. Focus on the fact that if Isabella takes your teeth out and you feel anything at all, just come to my office and say, give me my money back. And I'll just go, here you go.
You can't get a better guarantee than that, can you?
Well, he came.
Oh, please don't tell me.
He came. He did it. And then they called me and they said he wants to see you.
Oh, God.
So I went down and he went, you're a shit, you know. I said, why? And he goes, you put that thing in my head on purpose. I said, did you feel the teeth coming out? He went, obviously not. But how happy and how glad are you that the nightmare is finished for good? And he just burst out crying.
Yeah.
He gave me a hug.
I think, I can remember that bit well. Afterwards, just that feeling of relief. Just incredible.
Well, how important is it to you of the finality of it all? Of the finality of the suffering, where you just know you're just in a new place?
Huge. I can't even sort of put that into words. Like I was saying, I was getting nightmares several times a week about, have I lost a tooth? Am I about to lose a tooth? That has just dissolved. I don't need to worry about that anymore.
It's people like you that keep motivating me. I watch you. I was overwhelmed by how brave and honest and open and sharing you were with, let's face facts, strangers.
Yeah. I think that was because I felt such gratitude for the end of that suffering. And I think I was speaking to you earlier about, there was lots of people that had put their journey on there, but in picture form. And for me, doing the job that I do, I wanted to see the effect that it had on my speech and genuinely be able to see how everyone's mouths were moving and whether the smiles were genuine. It's so easy to put a filter on things these days. But yeah, it was hugely emotional. I was very, very grateful. So if that's swayed one person to having it done,
you've
then
a lot more than one, Harry. A hell of a lot more. You're like the poster boy of the group. Right? So Gordon's a bit bothered. He goes, they're watching Harry's videos more than they're watching mine. I'm like, Gordon, it's not a competition, Gordon. You know?
Yeah, that wasn't the goal. But yeah, if it's helped anyone sort of make that decision, I'm happy with that. And I've even been getting patients saying, you're in a video on Facebook.
Cool,
like,
yeah, that's me. I love that. And I want more of it. So our colleague there from the US, would it be safe to say you're in shock from what you've seen in the last 2 days here?
Yeah.
Yeah, okay.
You're incredible. Your transparency is...
Yeah, I think it's just coming from that place of fear to coming out the other side and thinking, because I was in such a desperate place that I thought, what is the way out with this? And then obviously doing the research, finding 21D, I was like, oh, this is my way forward now. And yeah, like I said, easily the best decision of my life.
That is fantastic to hear. So I want to thank everybody for doing this. I really, really, really appreciate it.